Hello everyone, my name is René Salgado and I serve as president of EmpreSomos, a nonprofit social enterprise dedicated to sharing and disseminating relevant knowledge to strengthen the Central American entrepreneurial ecosystem. To learn more about our work, please visit empresomos.org. I am delighted to welcome you to our Entrepreneurial Connectivity webcast series. This dialogue focuses on a topic that is both timely and vital for Central America. How can we strengthen health systems and expand access to quality healthcare for underserved populations through innovative management approaches and leadership development? Today's dialogue is grounded in the work of Dr. Andrea Prado at INCAE Business School and focuses on the Latin American Health Management and Innovation Initiative, known by its Spanish acronyms ILGIS, and the CAHI-JEFE Fellowship Program. For Central America, where healthcare systems face resource constraints, rural populations lack access to quality services, and innovation is essential to address persistent health inequalities, a dialogue on building leadership capacity and scaling health innovations is particularly relevant. We are honored to have two distinguished professionals joining us today. Dr. Andrea Prado is a full professor of organization and sustainability at INCAE Business School, where she directs the STRATCAM Chair of Social Investment. She serves as the academic director of ILGIS, and which includes the CAHI-JEFE Fellowship Program, and has led multiple executive programs in health management and innovation at INCAE. Andrea received her PhD from NYU Stern School of Business. At discussion, we have Professor Thomas Lyons from the University of Tennessee at Chattanooga. He is an expert in social entrepreneurship, entrepreneurial ecosystems, and skill development for social innovators. Thomas brings a wealth of experience in understanding how entrepreneurial approaches can address social challenges, thus making him an ideal commentator for today's discussion on healthcare innovation and leadership development. Here is how we will proceed over the next 60 minutes. Introductions. Each panelist will briefly introduce themselves and their work. Then we will have a presentation. Andrea will walk us through ILGIS and the CAHI-JEFE Fellowship, including the initiative origins, structure, and approach to accelerating health innovations, as well as lessons learned from building a network of healthcare leaders across Latin America. Then we will have the panel discussion. Thomas will engage Andrea with questions, comments, reflections, and feedback. And we look forward to an engaging and insightful discussion. Let's begin. To start, I would like to invite each of you to introduce yourselves. Andrea, would you like to start?
Yes.
And I hope that I pronounce, the names properly, Andrea.
It's okay. Thank you. So yes, I am a professor at INCAE Business School. I have been here for 15 years. I got my PhD at NYU, and there in the management department, I was working on sustainability issues. And a lot of the sustainability had to do at that time and in the US, focusing on environmental issues. When I returned to the region, when I returned to Central America, and when we see the social challenges, the levels of poverty, and when you say social challenges, of course, education and health are in the top of the list. I decided that I wanted to start working a little bit more on the social part, but also it happened that there was a person from New York City called Robert Jeffy, who was very interested in working with NYU and Stanford and bringing that knowledge to support the health systems in Central America. So, I was just graduated. I was supposed to just be working and publishing. But I took the challenge because this was going to be doing, not just publishing, but doing things with the practitioners. So I have been doing both for almost 15 years that I have been in the region, and I will be sharing with you what I have been, let me talk in a we, because it's a team of people at INCAE, that we have been doing to improve the access, the quality, and the affordability of health services to Latin America. So that's me. Thank you.
Thank you very much. Let's go with you, Thomas.
All right. Thank you, Renee. My name is Thomas Lyons. I am a professor of entrepreneurship in the Rollins College of Business at the University of Tennessee at Chattanooga. I have a bit of an unorthodox background, though, that kind of brought me to social entrepreneurship. My PhD is actually in urban and regional planning, and I've done a lot of teaching in the area of community development, particularly community economic development. And when I first started out, I was working in public policy schools. And it wasn't until about midway through my career that I transferred into business and kind of became the social voice and the voice of ethics in business in the school where I was, Baruch College in City University of New York. And that kind of then has led me to where I am now, an interest in social entrepreneurship and entrepreneurship and its role in community economic development, as well as an interest in what makes social entrepreneurs successful. And I've been looking at skills, social entrepreneurship skills in particular, and what they are. What are the essential skills? How do I measure them in ways that allow me to act on the ability to develop those skills? And so that's where I'm coming from today and every day these days.
Great. Okay, Andrea. You wanted to share your screen.
Yes,
Okay,
so I
feel.
would like to share a presentation. The presentation is in Spanish.
Yeah.
Most of our stakeholders are in the region. We are working, and at this time, and this is a program that started in 2013. At this moment, we are working hard on bringing local supporters, local partners. As I mentioned before, all this started with the great commitment and support of Robert Jeffy. But now we have to bring the locals. If we are generating value, we should be able to raise funds and engagement from the local organizations interested in this issue around healthcare. So let me just share with you first, in terms of healthcare, just a brief introduction. We have the technologies, we have treatments, we have the policies that are necessary to actually bring services to the population. Unfortunately, a lot of that innovation really doesn't reach the people that really need it. No matter what is written in the policies, no matter that the treatment is available, it's available, but the people cannot afford it, or that the technology exists, but it doesn't reach the facilities. Healthcare is, in Latin America, sadly, is very unequal, the access to these services. And of course, in terms of equity, the populations that have less access are the ones from rural areas, the indigenous people, the low-income populations, and the health systems are, some of them, very fragmented. Who is providing the services? We have public sector, private sector, civil society. In many countries, in rural areas, what you find are civil society organizations, non-for-profits, providing those services because the government is non-existent. And of course, lack of resources and lack of leadership. So what we decided, remember, we're a management school, we're not public health school, but we decided we want to support this because what we realize is that first, health is a matter of competitiveness for a country. Two, it has very significant social implications for the countries. And also, many of the challenges that they are facing have to do with management, management in the policies, management in the facilities, lack of entrepreneurs who are developing things that can make these services accessible. Everything that we do here at INCAE around health, we put the patient in the center. The patient or the citizen. Hopefully, they don't have to get sick. Hopefully, they don't have to be patients. They are just people that are taking care of their health in a preventive way, or we promote that they engage in health initiatives so that they don't get sick. So the point is, everything that we do is to improve the quality of health access and services to the person. And in that regard, again, we don't understand health just as oh, I'm sick, the lack of disease, but instead it's a wellness. It's a more holistic concept that includes the mental part and the social aspects of the healthness, the wellness of the person. Each dollar that you invest on health has a big return. It returns 2 to 4 times in terms of the productivity of the economy. It also has implications in terms of the amount of jobs. So each employment that you provide in the life sciences, it creates 5 additional jobs in the economy. If you provide health services, you can liberate, you can free the time of those people that are taking care of people that are sick, for instance, and those people then can go into the job market and generate income. So the labor market becomes more dynamic. It improves the productivity. If you have healthy people, of course, improves the productivity and decrease the losses regarding the expenses for the country in health, if people are healthier. And then if governments can provide health services, people invest less from their own pocket. And that's one desirable thing. Unfortunately, in Latin America, we're spending too much out of people's own pocket. So at INCAE, we have what we call the Iniciativa Latinoamericana de Gestión e Innovación en Salud. And this initiative has 3 components, and I'm going to go into this directly. One is, how do we generate knowledge? Knowledge that is applicable to the region. It's not the same. The health system in the US is very different at how the reality of our countries works. So we need to understand what are the challenges of the region. And for that, we need to develop research, but not just academic research. It has to be a research that really informs the decision makers. The other one has to do with training. And in terms of training, we need to support the management and the leadership capabilities of the people in the health sector or in the life sciences sector, where many times what you see in hospitals are doctors taking managerial decisions because they are very good doctors, and instead of them, they promote them, and the promotion is they go into management, and then the patient loses and the management can be so-so. So then we are supporting the acquisition of those capabilities. And the third pillar of this initiative is the creation of networks. And I think the innovations that happen in one country, how do we support so that that can be scalable in the region? So in terms of knowledge generation, what do? We do academic research, but that one goes a lot into academic journals that not necessarily decision makers or practitioners read. So another thing that we do is we document success cases. What are good practices? We document them, we share that in our classroom, we publish them to success cases in terms of public health, of innovation, and on resilience of the systems. We have developed some knowledge in that regard. After COVID, we were engaged in a research project around that. And then we don't just publish it, but we organize events to share that knowledge and diffuse that information. These are some of the publications that we have done, some of them having to do with how the expenses on health are going to grow in the next 30 years. We have an aging population, and that has strong implications for the expenses and how fast they are going to grow. On the primary health care and what are the effects of providing stronger healthcare at the primary level of attention, which is cheaper. It can be more effective, right? Because then you do prevention and you do promotion. So these are some of the research that we do, again, with very important implications for practitioners. We do this research with international partners. It's not just INCAE. And let's go now to the second pillar. As a management school, we do training. And in that regard, we can do training, and we have done training to social securities or ministries in Latin America in terms of their management skills. Sometimes, and the Latin American audience, I'm sure, can get familiar with this or can identify with these situations. Sometimes you go to a hospital and the lack of service is a bad management system for the appointments, or the lack of medicines or availability is because they don't know really how to do the procurement correctly, or there are inefficiencies in that regard. So again, many of the challenges have to do with limited managerial abilities. So that's what we are working with in terms of governments. We also work with the life sciences industry, so medical device companies or pharma, and then we have open programs. But the one that I would like to emphasize today, because we're talking about entrepreneurship, is this program. This is our flagship program, and this is the one that Bob Jeffy, the person like that supported this at the beginning and still do. We work on this since 2013, and I would like to put a zoom into this and share with you some of what we have learned. This program is not just training. It's not just training because we ask the participants to come with a specific project. They apply with a project that they want to implement, and we choose based on the impact of that project, the feasibility of that project, and the background of the leadership of the person. So that whatever we give them in the classroom doesn't just stay in their heads, but they actually have to apply it in their project, and we support them throughout 9 months to make sure the project gets implemented successfully in the region. So this fellowship has a couple of components. One of them is the training that we do 3 modules in person. And that is, let's not underestimate the power of putting people together in a classroom, in a campus, rather than online. I think the virtuality has done beautiful things, but if what we want is cohesion, exchange of knowledge, support for them to become friends, for them to become people that when you have a problem, you can call or find that level of support, we need to put them in person in the classroom. And these weeks, these are 3 weeks that they meet in person. We rotate the countries. And every time we go to a country, we go and show them and visit some health facilities, some health entrepreneur, something around health. So we do field visits and we are not just staying in the classroom. We will go over a little bit what we see here in the training. The other component is that we find mentors. And I'm sure Thomas, who works on entrepreneur, knows the value of mentorship for entrepreneurs. So we have at least 50, a network of 50 mentors, but these are mentors that are very senior. Some of them are retired, but they have spent their whole career in the Pan American Health Organization, in the Social Security, as academics or as entrepreneurs. So we find those mentors and we assign them to the fellows. And the other thing that we do is that we very intentionally, to make our network of CAHI fellows stronger, we also assign former fellows or alumni to the fellows of the current edition. And that's very important because, one, we can assign former fellows or alumni from the same country, let's say from Guatemala. If you're from Guatemala, you will get a fellow from Guatemala. But if your project is on mental health, I will assign you one fellow in our network that is also working on mental health, even if it's in another country. And that's part of a very important thing that we want, which is that creation of a network. One of the important things of this acceleration program, and I must say, we arrive. This has been a learning experience. And we have been improving, and at some point we were incubating, and by now we are accelerating, and we have learned many things, including that a lot of the success of the fellows is on the selection process. And in that regard, for instance, we have become more rigorous on the selection. Now they apply. We invite them to a boot camp where we provide them content. They improve their proposals. We get to know them. That one is online, right? Because it's a bigger number of people. But that is, again, to improve the selection process. The other thing that we have learned in that regard is, like, when we have projects from the public sector, we ask them to come with the green light, with the support of the boss or of the institution, that the institution agrees that this is a priority and that the institution will support them, because otherwise it's very challenging for the person to get all these skills, to have this project and try to push it on its own. This fellowship program addresses, because health is not, we're not going to solve the health problems just from the private sector, or just from the public sector, or just from the NGOs. And we are illustrating that in the way we design this fellowship. So we have entrepreneurs from the private sector, but we have intrapreneurs from public organizations, and we have social entrepreneurs from non-civil society, from the civil society organization. And I think that is one of the most valuable things that we do, is we put these people with different logics, with the for-profit, with the public, and with the non-for-profit, in the same classroom. They all want to improve the quality, the access of healthcare, but maybe from a different logic, and the exchange that you get, the cohesion that you get is magic. really, even in the discussions in the classroom, how the different representatives address the same problem. We have a network already of 155 fellows. This program was on hold. We put it on hold during COVID. As you can imagine, it was very difficult to get people working on health during COVID to take the time to do a program like this. We have representation in 12 countries. The program started with fellows only from Central America. Now we open it, and now we have people from Mexico and from South America, very intentionally. If we add up all the people that have been impacted by these projects, we can add up to something like 155,000 people. They're not the same, because some people are working in children, others are working with senior people, others are working with cardiovascular disease patients. So it's different, but if you add them all up, you can arrive to some number like this. And finally, again, we are extremely intentional to develop the connections between the people in the same generation, but from other generations, together with the external mentors, and then our partners. Whenever we can, we show them off. We provide the spaces for them to pitch or to share what they have learned, so that other people can learn from their experiences. This is what last year, I think one of the biggest values that we have to make an impact is not just a single entrepreneur and a company that did this, is the network itself. So what we are trying now is, how are we leveraging the network of 155 fellows that we have in the region? And that's our bet, is to support that, to strengthen that, because then you start getting critical mass. For instance, in Guatemala, we already have a very interesting group of people. We have people who have been ministries of health, other people that are in rural areas, others that are entrepreneurs, others that are directing foundations. So for instance, there was a woman leading a project in rural area to help mothers with children with disability in rural Guatemala. In the network, there is also the director of the neurological center in Guatemala City. So that when that woman in rural area identified these children, some of them needed to be referred to the city. And then, because they are in the same network, they were able to work on that. And like that, for those that are doing businesses. If you're doing a business and you want to enter in El Salvador, you're Costa Rican, you want to enter in El Salvador, but you need to understand who is who in the health sector, then you have a network of Salvadorian CAHI fellows that can support, helping you identify where are the opportunities and what are the needs of the market there. So this is what we're working on. And betting for the future is to increase and potentiate this network, which again, I'm sure Thomas, and we can talk more about that, knows that when fellows come, and fellows or entrepreneurs come into this acceleration or incubation programs, and you ask them, what is the best what did you enjoy the most? Or what is the most valuable thing you take away? And people say the network. I mean, entrepreneurs, leaders, many times they are so lonely. They don't have within their organizations the people to talk to about their fears and their failures and their doubts, right? If you are the boss, who are you going to talk to? So that is the space that we are trying to provide. And then the third pillar of our initiative is just, again, one thing is the network of our fellows, but in general, we are supporting the creation of ecosystems or or spaces where different actors involved in health can converge in the different countries. For instance, we organize activities that have to do, that address specific topics. So in this event in Guatemala last year, for instance, we had a person from the Ministry of Health, an academic of the most prestigious organizations that work on healthcare, and the representative of the Center of Companies, Corporations working on corporate social responsibility. And they all were addressing the same topic because they all want Guatemalans to have access to healthcare, better access to healthcare. And those are the spaces and dialogues that we bring. In Panama, we also participate in some of these networks. There are some networks, some of them more in health, others more in management, that we participate, that these are global. Actually, Health Systems Global was having the meeting in Dubai, and we don't know what's going to happen, but this one, again, these are centers of exchange of knowledge, and then we participate there, and we can bring all that know-how. So that is what I had to share with you and what we're doing here. So thank you for the space. Rene, you are in mute.
I have one brief question before you engage with Thomas. Okay, one is how are the fellow? Do you promote the information about the about the fellowship opportunities, so to speak, and so and then that's one. How do you promote that? And two, do fellows have to pay for, or is completely covered?
Two great questions. We share in social media. We send the invitations through our own network of fellows. We ask them to please diffuse the call for applications, and we are always looking for places to increase the number of applicants. This year we had 188 applications. That's significant, particularly because we are asking for projects. For instance, if it's an entrepreneur, they have to have sales. If it's a public, it's just not ideas. They have to have pilot projects, and it has to be clear that they are already doing something and that they want to accelerate. So 188, it was actually almost 40% increase from last year, and a lot of it is to do with the efforts to diffuse. So next year we would gladly share it with you, Rene, and you can help us.
Sure,
diffuse that.
Absolutely. Count on that. And do they pay or something or no?
This is a program that has been evolving.
Okay.
So with the generosity of Bob Jeffy, for the first years, we had 100% scholarship.
Mm-hmm.
And that has been evolving because, like any social entrepreneur, we need to find sustainability, and we cannot depend on a donor.
Mm-hmm.
And that's why I was emphasizing that we are now looking for local partners. Mm-hmm. Bob Jeffy, very generous, but he's from New York. And again, if we are generating the value that we claim we do for the region, we should be able to find organizations in the region that are willing to support these entrepreneurs. So that is to say that now, for instance, we don't give 100% scholarship, but it can go from 75% scholarship to 10%, depending on whether you come from the civil society or if you come from the private sector and you have a lot of sales, then you don't need a 90%, you need a 75%. But it's a highly subsidized program.
Okay, and yeah, the last point, probably your local circles, your national chapters, if you wish, are going to be part of that sustainability effort, because they can act as your ambassadors and
Totally.
in each of the country. Mm-hmm.
Totally. Ambassadors, and it's not necessarily that they will give money or contribute money, but for instance, in Honduras, one of our fellows from the seventh generation is now the Vice Ministry of Health. And it's not just that, that's a great presentation letter for us. And the same with an entrepreneur from the first generation that started with a little enterprise, and now he's operating in like 5 different countries in Latin America, right? And he does all these information systems for medical records and things. So our own fellows are, as you say, our ambassadors or our presentation letter.
Great. Okay, I stop here. Go ahead.
Let me just start off, Andrea, by saying kudos to you and your team, because this is a very exciting set of initiatives that you have here, and there's a lot of moving parts, which is fascinating to me because I'm fascinated by ecosystems. And I'm wondering if you would agree, I think I'm hearing this, that not only are you creating an ecosystem within your initiatives, but you're reaching out to build a bigger ecosystem throughout the region. Is that fair? And where do you see this going as you move forward?
I think that first, as you say, we are working on our network. And I think that's what we can control the most. We are growing, so it's not that we are we are looking for financial resources to make this sustainable, to invest on these things. And some of these things, Thomas, are intangibles, right? So if you ask a donor, can you support a network? The activities that will happen within a network, knowledge exchange, and they meet and then they can collaborate. It's some of an intangible. So that's our focus at the moment. We are actually, hopefully this year, we will put a call for applications within our network for projects in collaboration to promote that instead of just local chapters, we increase the collaboration to whatever is needed. For instance, there is a fellow from Guatemala, the director of the Neurological Center for Children with Disabilities. It happened that now one of our fellows in Panama is the director of the Center for Children with Disabilities in Panama. This one in Guatemala is developing this virtual program so that mothers in rural areas can have access to education and how to treat the birth, to stimulate their children and all. And she wants to grow. Well, if they can apply to a program together, that's what it's like small grants to motivate that collaboration. That's what we're looking for, for instance, for a donor to do that we are supporting. Because I think that's the next level. Now, INCAE is in Costa Rica, it's in Panama, and we really operate in all Central America, but that's where we have physical offices. So in Panama, for instance, we are working or supporting and participating in the development of this ecosystem. Panama wants to become a hub for research and innovation in health. So they're developing a cluster, and there we are with our fellows, working with the Social Security and the ministry and see how we can contribute to strengthen those efforts. The same in Costa Rica, but I wouldn't say that yet we are at the point where we're creating the ecosystem, but starting and strengthening our own network, I think it's very potent because we have people in the 3 sectors at very high levels.
Right. And of course, all ecosystems have to start somewhere, and it sounds like this is the nascent part of that, and that's what's exciting about it to me anyway. I wanted to drill down a little bit on some of the component parts of what you're doing. So you talked about generating knowledge, and it sounds like, unless I'm misinterpreting you, it sounds like you're doing some basic research, but you're also focusing on what used to be called applied research. I think it's being called translational research now.
Mm-hmm.
So actually getting the knowledge from the university out into the community to solve the community's problems, which sounds very much like what you're doing. I know from our own experience here at UTC, one type of translational research that we're beginning to pursue is research commercialization. So trying to figure out how we could help people either stand up a business around an invention or an innovation of some type, or license that to people out in the community who can use it in their processes. Are you doing some of that? Is that part of what you're doing?
We are thinking about it, but we're not doing that yet. One of the things that we're doing is we are doing the academic research and translating that into how that can influence the makers and the practitioners. But that translation is, what do we understand by translating? So what we do is either publish in more practitioner-oriented journals, but also organizing events where we have practitioners and we have us academics sharing like the knowledge, and they kind of share how that knowledge is applied on their, or how they connect. For instance, we did this very interesting project with Gates Ventures and Exemplars for Global Health, where that project worked on documented how a health system was able to continue providing services even though we were in a pandemic, right? Because we still need to treat diabetics and cardiovascular and the people with COVID. So, and at the same time, deal with the pandemic. So we identify all the good practices. We, as INCAE, participated and documented the case of Costa Rica because that was the one that was chosen by this global network. But there was also the example of Taiwan, Burma, Ghana, and Dominican Republic, and all that research where we compare really what are the good things to continue providing essential health services during a crisis. And that was shared with decision makers in different countries in Latin America. That's
great.
At the moment what we're doing.
Yeah, no, that's good. And the reason I ask that question is because my university is not a designated research university. We're a balanced university. So teaching and research together are the expectation for the faculty. And yet there's a strong interest, and it's really a push from the community for us to be more engaged in translational research and particularly in research commercialization. So what we're finding is we're having to do a lot of the kinds of things that you're doing to build your initiatives, which is beginning to build networks of our research faculty, networks between the research faculty and nodes of support for them on the campus, and ultimately then reaching outside the campus for other nodes of support that we can link to that. So it's all this social capital building, both bonding and bridging that we're doing. So I find that particularly intriguing.
I think it's great. I guess your university has like an engineering department and
It does.
Us at INCAE, we're only management. We're just a business school. So that's a little bit more limited from our perspective in the sense that what we can provide is the commercial part, the business managerial part.
Right.
So for instance, in Panama, we came close to CENACID, which is the Center for Science and Technology that provides a lot of scholarship to scientists to actually invest in science and knowledge and new things. And we are in a discussion to see if there is something that we can provide to support them bringing that knowledge or that device or that innovation out into the market.
Yeah, exactly. That's exactly. I mean, yes, you're right. We can do that internally because we have those science and engineering and computer science schools that we can draw upon. But as you point out, you can do it externally too,
Yes.
and still be the business school that's helping do the commercialization, which I think can be a pretty powerful thing. I also wanted to talk a little bit about training because something you said resonated with me and my own experience. You were talking about the medical professionals and how the succession ladder takes them up to a point of leadership, and unfortunately, that's kind of taking them to their level of incompetence, right? They're not trained to be
Sometimes,
leaders.
yes.
So you're trying to help them to overcome that. And I'm curious as to what kinds of skills are you helping these healthcare professionals to develop?
Okay, so one thing, when we have fellows, we can do training in the fellowship, in the acceleration, and there we have not only health professionals, we can have lawyers and engineers, but they come with a specific project that we can. So what kind of things do we teach them? And this is also translated into those programs, for instance, that have to do with the that we have provided to Social Security courses on how to manage waiting lists, right? That it's like an industrial engineer knows how to do that better than many times people in health organizations. So we teach or we emphasize a lot in the fellowship, for instance, the leadership skills. But more than just decision making and just simple leadership is the idea and the commitment for them to become agents of change in a region like ours. So we go even beyond. We look at movies of Gandhi, we read Plato, we read Hamlet, like things to really understand if they want to respond to that call, to that calling, right? Because being a CAHI fellow, sure, you come with a project, that's great. Maybe the project, as any innovation, at the end it doesn't happen, or something happens that doesn't go through, but we keep the fellow. And that fellow needs to understand, or we hope they have become committed that they are agents of change. But in terms of management, we work with them on how to work with people. I think they need to manage people, work with teams, and they don't necessarily have the skills or know how to do that. Also project management, specific projects, how to get that, strategy development. And one of the last module have to do with skills like negotiation, communication. That's absolutely key to sell anything, to sell your project, to pitch your idea, to get funds, anything that it's communication. And political analysis, health is political.
Yeah.
And it's political not in terms of who's in power, but political in understanding what are the stakeholders, who can be in favor, who can be against, what is going to be my strategy so that I can overcome these. So it's a political analysis of the forces against or instead that can support my project. So these are skills that are, again, we are assuming these people are already almost in leadership positions, and they kind of need all those skills, plus the strategy and the marketing and the cost, how to develop the cost strategy for the for the project. But these other ones are like bigger.
Yeah, yeah, no, that all makes sense. So what some people call hard skills, but also soft skills. And
Correct.
as a matter of fact, you're kind of bearing out my thinking on this because I've tried to identify the skills that somebody needs in order to be an effective entrepreneur or an effective social entrepreneur. And they're the kinds of things you're talking about. So there's business management skills that are the table stake skills, if you will, of business. You have to have them to get in the game. There's skills necessary for managing organizations. There are skills with regard to relations and managing people inside and outside your organization. And then there are a set of change management skills that are the really soft skills, the learnable traits that psychologists talk about. So it sounds like you're covering that waterfront, and that's very interesting to me. And this is purely out of curiosity. When you talk about the Jeffy Fellowships and the Accelerator program, it has elements in it like the training, the mentorship, the building of the network, the fellowship support. It sounded a lot like the social venture philanthropies like Ashoka and Echoing Green and the Acumen Fund. Were those inspirational to you at all when you were thinking about putting this together?
I think one that was inspirational was also one in Central America called the Central American Leadership Initiative.
Mm-hmm.
And yes, they are. And we were very keen on the diversity component of the generation, meaning we
Right.
want people from the different sectors with projects from the different sectors and put them all together. So yes, Ashoka and these other programs have been, but sometimes they only work with social entrepreneurs. And
Right.
here again, we mix people from the public sector that I don't know if we call them social entrepreneurs or just a public servant, or how do we call them, or
Mhm.
entrepreneur within a public institution,
Right.
right?
Yeah,
So
no, that's great observation because I've had that struggle myself. And some people think the answer to that is to call them social innovators, which seems broader. And
okay,
some people think that when you say social entrepreneurship, that's only about business people. I
mm-hmm.
don't agree with that. But I think it has to do with how we define innovation and how we define creativity. And I don't think they're the same thing. So you've got people
Yes,
who are inventing things, they're being creative, but you've also got people who are figuring out how to get those inventions, whether they created them or not, to the people who need them. And that's being innovative. And that's what
totally,
entrepreneurs do.
totally.
So it's kind of confusing. I think we may have created our own monster by conflating creativity and innovation, but and thinking that somehow entrepreneurship is only about business people. Um, I don't think it has to be. I think those
Yes,
skills of leadership.
and also thinking that innovation is just in products, when it is,
Yes.
as you say, it can be in processes. So we have, for instance, and we emphasize that a lot, we have had people working in rural Honduras, and where children still die out of diarrhea, where
Mhm.
we have pills that cost nothing that can prevent that, a death of a child. And the innovation then is, how do we make sure that that pill reaches that child on time?
Right,
It's
right.
not, oh, we're going to develop the cure for cancer. That's not
Mhm.
it, right? It's the business model innovation, the process to
That's
make
right.
that happen.
Yeah, when and especially if you're working in developing economies, the innovation is usually catalytic innovation. It's finding ways to repurpose things that are already there in the environment in an innovative way. And as you say, you have what you need really there. It's more about making those connections. And I think that's one of the great things that you're doing is building the networks that are necessary to actually get solutions to the people who have the problem. And that's always the challenge. And that's what I love about entrepreneurs because that's what they do. They figure that out.
Yes, yes. And then again, you put them all together and magic happens. If you give them all the skills, they're curious enough. That's why I insist the selection process is key in these programs. And one of the things that we also address in the training is public-private partnerships and how to develop that. And for healthcare is absolutely key. Again, there are some things that the public sector has, but not the private, but the NGOs are already in the community. Like, how do we work together? And one of the barriers that we have to overcome is just a mental barrier, like, oh no, the public is, the public sector is very inefficient or bureaucratic, and then I don't want to work with them. Well, then how are you going to reach the whole country?
Yes.
Right?
Yeah. No, absolutely.
So that overcoming those sometimes barriers, mental barriers to work together with people from other sectors are ease if you put them all together in the classroom.
Yeah, it kind of goes back to what you were saying about the quote unquote politics of all of this, which is really more about how do I manage resistance. So I'm going to have some threat-based resistance because people think that this is somehow upsetting their apple cart, goring their ox or whatever. And then you have inertia-based. I like it the way it's going now. It works for me, so let's not change anything. And both of those things need to be deftly dealt with if you're going to move forward. And that always takes me back, I think, about some work that a researcher named LaFrance and some of his colleagues did, where they said, well, there are these capacities that have to be in place if you want to really scale something. And if you address those and you look at what they really are ways to get out ahead of this potential resistance, which, as you say, I think that's crucial here. If you're going to be successful. So I like that thinking about the politics of all of this. It's an important aspect.
So you agree, Thomas, that Andrea is not just a social innovator, but a great social innovator.
I agree. I agree.
Absolutely. It's fascinating, what she's doing.
Thank you, Renee, and thank you, Thomas.
Yes, thank you.
No, I mean, the appreciation is to you. This is a very interesting project and program. I like it, the fact that you grounded it, Andrea, in how important is health for both economic and social development.
Completely.
And then somehow that's your foundation, and it's a great pitch, if you wish. It's nice. So
thank you.
Absolutely, and there was a lot to learn, but I don't know if you want to continue the conversation or if you have another question, Thomas, or you have.
I think I've asked the major questions that I wanted to ask. So
Great. Okay. Well, I'm going to say thank you very much, Andrea, for this wonderful presentation. I learned a great deal, much more than what I learned the other day when you had the presentation with your fellows. And I am sure that many other people in the region are going to learn about your effort. That this and of course we hope that you are going to have lots of local partners, because it's a great initiative. Definitely.
They are coming. It takes time to build the critical mass, to make sure we have those ambassadors that speak for us. But we're almost there. We're actually doing very well this year. And actually, we start the 9th generation on Monday.
Wow.
With the first module. They will be here. And we have people coming from Argentina and everything here at INCAE, Costa Rica.
Right. And the program is for 9 months, Andrea?
It's for 9 months, but we have 1 week here, 1 in Panama, and 1 in Guatemala.
Okay.
All throughout.
And the remaining portions are in, how do you say, is online?
We give them webinars. They need to apply what they saw in the classroom in their projects, send it to us. We give them feedback. They need to meet with the mentor. So between module and module, they are super busy. It's not that they go back, and they are very connected and engaged.
Wow, that's interesting. And then the whole network is contributing with their ideas and what have you. Because I mean, it's not only you as teachers, or but you have the whole network somehow contributing with one another. Is that right?
Correct. That is
Great.
correct.
Incredible, incredible. No, thank you very much, Andrea. And I only want to say, ask for our audience to subscribe to our YouTube channel and to our LinkedIn channel as well, because, to get the benefits of these, great presentations and learning, for everyone.